Discovering blood in your semen, a condition known as hematospermia, can be a frightening experience for any man. However, it's often a benign and self-limiting condition, particularly common in men under 40 years of age. The causes of hematospermia are diverse, ranging from common infections and inflammation to injuries. Infections of the urogenital tract are a frequent culprit, especially in younger men. These can include sexually transmitted infections like chlamydia and gonorrhea, as well as urinary tract infections and prostatitis. Inflammation of the prostate, seminal vesicles, or urethra can also lead to the presence of blood. Physical trauma or injury to the genital area, including iatrogenic causes from medical procedures like prostate biopsies, can also be responsible. Blockages in the ejaculatory ducts or cysts in the seminal vesicles can cause hematospermia due to ruptured blood vessels. Less commonly, vascular abnormalities such as hemangiomas or arteriovenous fistulas may contribute to the condition. Systemic conditions like hypertension, liver disease, blood clotting disorders, and certain cancers can also be associated. Other factors include prolonged sexual abstinence, frequent or intense sexual activity, and, rarely, reproductive organ tumors. Often, the exact cause remains unknown, and the condition is then classified as idiopathic. The primary symptom is the brownish-red or red discoloration of semen, which is usually painless. However, depending on the underlying cause, other symptoms might include pain or burning during urination, or painful ejaculation. You might also experience swelling or tenderness in the genital area, frequent urination, or difficulty emptying the bladder. Fever, chills, or night sweats could suggest an underlying infection. Diagnosis typically begins with a detailed medical history, including sexual history and any prior urological procedures. A thorough physical examination, including a digital rectal exam for prostate assessment, is also crucial. Urinalysis helps detect infections, and STI testing is often recommended, especially for younger men. For men over 40, a prostate-specific antigen or PSA test may be performed to screen for prostate cancer. Imaging studies like transrectal ultrasonography or MRI might be used for persistent cases to evaluate the prostate and seminal vesicles. A cystoscopy, involving a small camera inserted into the urethra, may also be performed to visualize the urethra and bladder. While often benign, it's important to seek medical evaluation if you are over 40 or if hematospermia is recurrent or persistent. Also, consult a doctor if you have associated symptoms like pain, fever, or urinary issues. Risk factors for prostate cancer, such as a family history or an abnormal prostate exam, also warrant medical attention. Treatment depends entirely on the underlying cause. Bacterial infections are treated with antibiotics, while anti-inflammatory medications can reduce inflammation. Ejaculatory duct obstruction might require a transurethral incision, and an enlarged prostate could be treated with finasteride. In many cases, especially for younger men with isolated hematospermia, reassurance and observation are sufficient as the condition often resolves on its own. The prognosis for hematospermia is generally good, with most cases being self-limiting and resolving without long-term complications once the cause is addressed. If you found this information helpful, please like and subscribe to our channel for more health insights.